Hi, we're going to be talking about the heart. Um, so there are five prominent points on an ECG, which is the P wave, QRS complex, and the T wave. Well, that's three of them. But this is the P wave, the QRS complex, and the T wave. Um, the P wave is the depolarization of the atria. The bigger the QRS complex, um, that's the depolarization of the ventricles. And then the T wave is the repolarization of the ventricles. Repolarization of the atria happens during the QRS complex. Um, the P wave is the atrial depolarization going into atrial contraction and ends at the start of the QRS complex. So it starts and then it ends, and then there's the QRS complex. And then the PR interval, which is right here in between, that starts at the beginning of the P wave and ends at the beginning of the QRS complex. Since it measures the time in between the start of the atrial depolarization, which is the P wave, and then it starts and the start of the QRS complex. The PR interval, that's pretty important. And then the QRS complex, that's the rapid ventricular depolarization causing the ventricular contraction. And then there is the ST segment, which is here. And the ST segment is when the ventricles are depolarized and actually pumping out the blood. Then the T wave is the ventricular repolarization causing ventricular relaxation. The heart has a lub-dub sound and only two that we can hear, which is the S1 and S2. S1, that is the lub, that's the first heart sound. And it's produced when the atrioventricular valve closes during ventricular contraction. The second heart sound, dub, that's when the semilunar valve closes, which is the S2. S3 happens during rapid ventricular filling and can sometimes be heard in kids, some athletes, and pregnant women. If you're able to hear it later in life, it may be an indication of CHF. And then S4 happens before S1. It's caused by the atria contracting and forcing blood into stiff or hypertrophic ventricles and can indicate left ventricular failure. Blood flows continuously through the heart's four chambers: the right atrium, the right ventricle, left atrium, and the left ventricle, directed by four valves stopping the backflow, starting with the sinoatrial node with SA. An electrical conduction system strictly controls the physical movement. Changes in pressure through contraction and relaxation are important for this process. The heart is an involuntary muscle, so it contracts on its own automatically. It is striated with intercalated discs to keep consistent beats, and important for circulatory flow um, by the coronary arteries. This allows the heart to pump constantly, changing cardiac output depending on the body's needs. Since the cardiac output is the amount of blood pumped per minute and is controlled by the heart rate and stroke volume, it is important for maintaining homeostasis and supplying oxygen and nutrients throughout the body. Cardiac output has to meet metabolic needs, like delivery of oxygen and nutrients to the body. During exercise, our heart rates increase to supply active muscles, and when at rest, it decreases to maintain energy, guaranteeing continued blood circulation and removal of the waste. Some of the effects of aging, imbalances, and diseases of the cardiac or cardiovascular system um, includes heart failure, stroke, hypertension, and arrhythmias. Um, those are more likely to increase with age. Stiffening of the arteries, thickening of the heart muscle, and electrical signals slowing down. These conditions can become worse by imbalances in blood sugar, cholesterol, or inflammation, which can cause a heart attack or atherosclerosis. Diseases can decline due to age, and have an impact on the quality of life and the tolerance for certain medical treatment, including surgeries. That's it for my heart presentation. Hope you enjoyed.